All right, Saagar, what are you looking at?
Well, let me say this at the top. I am as sick of doing COVID monologues as some of you probably are of hearing them. But like it or not, COVID and how we deal with it, it is the single biggest issue affecting the majority of Americans' lives right now. Masks on or off? Boosters or no? Can I get a rapid test? My friend who I saw 3 days ago has COVID. Do I need to do anything? My kid's school is closed. Now it's open. Now it's closed again. On and on and on. It's been a miserable 2 years. And the singular fight of our time is, do we keep allowing them to make our lives miserable, or do we say enough? Now, despite their best efforts, the vast majority of Americans are in the latter category. The problem is that the ruling elite are not there yet, and in their quest to gaslight us into living our lives in fear, they have corrupted some of the most important scientific institutions in American life. Think about before this pandemic, the reverence with which you thought of the CDC, or even the FDA, or the National Institute of Health. All three I listed have lied, obfuscated, and disregarded the basic scientific process in the quest for social compliance. The latest example is right there. Truly sickening, though not surprising. Those of you who are New York Times subscribers may have seen this terrifying headline. COVID may raise the risk of diabetes in children, CDC researchers reported. Oh my God, let's keep reading. A CDC study says there's a 2.6-fold increase in new diabetes cases amongst kids. That is obviously terrifying. And the implication is that draconian measures like vaccine mandates for kids, masks in schools, forever virtual learning, and pandemic forever policies are way more justified. There's just one problem. The study is complete BS. Dr. Vinay Prasad, he explains several problems with that study. Number one, the entire analysis hinges on the idea that age and sex-matched kids without COVID should be comparable to kids who got COVID in terms of diabetes. Given that COVID is more likely to affect kids of lower socioeconomic status, that those kids are way more likely to be overweight or suffering from other medical problems, this is already an issue. Does the CDC correct for that in their study? No. Next, they're only studying reported cases of COVID in kids. They're not getting a real sample, given that probably the majority of kids who had COVID never even had their case reported. Is that adjusted for in the study? No. Third, kids who seek medical care for COVID are way more likely to get blood tests than those who don't. Thus, this would also capture diabetes much earlier. Is this corrected for in the study? Repeat it with me. No. Finally, one of the databases that they use for COVID cases does not include any distinction in the severity of the COVID case per child and uses the control group of kids who may have not been getting negative tests just for travel purposes. Again, is there any control or correction for this? No. One more, actually, as Dr. Prasad explains. Even if these results are true, the risk of diabetes due to COVID within 30 days was less than 1 in 1,000. So even in their flawed and bunk study was true, it still would not justify the scaremongering headline in the New York Times. Did the Times do anything at all to convey any of this? No. They simply print flawed CDC propaganda to justify what they really want, which is kids to get vaccinated and to justify draconian health measures in schools. Not a single word of criticism of the study. Think about the millions of parents who justifiably read that and they freaked out. How many are going to watch this monologue or read Dr. Prasad's piece? Probably a fraction. That's the point. This is only the latest example of the CDC getting caught with their pants down, pushing junk science to justify ridiculous pandemic measures. The other that I already brought you here in a past monologue, masks in schools. Let's review a little bit. The study they used to justify it included virtual schools in the control group, not open schools, and it was so flawed, many doctors said it would not pass a 7th grade science project. Yet, despite the obvious flaws and the fact that Europeans don't have masks in schools and don't have any measure increase in children's COVID cases, CDC director and the organization continue to this day to stand by it. We are seeing the wholesale disregard of science across the board towards social ends. Or perhaps you're like me and you got the Moderna vaccine. Well, the booster guidance was just changed to 5 months from 6 months. Why? Not by study of the Moderna vaccine, but based upon data from the Pfizer vaccine, which is a completely different dosage of mRNA. As Dr. Prasad says, the FDA has never changed a label for a product based upon data for a completely different product at a different dose at a different rate of adverse effects before. But you got to stick with the uniform narrative, and so science be damned. Take natural immunity. 140 global studies have now affirmed the power of natural immunity in combating COVID, yet it continues to not be recognized by the CDC. Why? because the CDC relies on their own flawed studies in their study of natural immunity. In almost every single one of these cases, you have the CDC with their bunk study rigged in exactly the way that they needed to justify public policy ends pushed from the top. And then, on the other side, you have the actual scientific consensus. Diabetes, masks in schools, booster guidance, natural immunity. 4 concrete examples of obfuscations, outright lies that are being used to scare the public. We need to wake up. This is pure manipulation of scared parents. But worse, it has established a criteria where when one of those organizations speaks, I simply do not believe them. By default. The default in the past was I believed, and then you had to prove to me that they were lying. Now my assumption with COVID is they are lying. What if we have a future pandemic where the mortality rate is 1%, 5%, 20%? You think I'm entrusting these people? Not a chance in hell. How many more are there like me? The government has abandoned science, and we will pay the bill for that for so many years to come. That diabetes thing is crazy, Crystal. I'm sure maybe you saw it, right?
I did.
Well,
Yep.
first of all, they put type 1 in there, and I was like, I don't think you want to say.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it, you get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.